It protects the public and the workers who are doing their jobs well. The techniques vary, but in the end, the principles are the same, the ideas are the same, and our basics are the same. Now you have three things regarding this topic. I have, as I mentioned, three fundamental principles. What is this topic? What is this topic? As I said, I have this honestly after the case. The team conducts the examination. For example, if you are a radiologist, this is your role. As a radiologist, you are responsible for interpreting medical images to diagnose and sometimes treat diseases within the body. The examination can diagnose various conditions such as fractures, infections, or tumors by using imaging techniques like X-rays, CT scans, and MRIs. I had a pregnant patient who came in after an accident, and it was necessary to perform an X-ray because if I didn't, her life could be at risk. In such critical situations, I need to carefully assess the benefits and risks involved in conducting the examination. Are the benefits from this examination greater than the risks? If the benefits are higher, then proceed with the examination. If the risks are higher, then do not perform the examination and consider other procedures or alternatives that might be safer for the patient. This is in line with the concept of medical exposure, which emphasizes the importance of minimizing unnecessary radiation exposure while ensuring that the necessary diagnostic information is obtained to make informed medical decisions. The people working with you, for example, during any procedure are directly exposed in the cath lab or in interventional radiology. Whether we can perform the procedure without scattered radiation also depends on the procedure you choose during your work. Okay? The dose parameters you work with, such as kV and milliampere, need to be chosen carefully. For instance, you should consider when selecting appropriate settings for the procedure. For example, in fluoroscopy, there is something called automatic brightness control, and you will find three modes: low mode, standard mode, and high mode. The low mode reduces the dose, while the standard mode applies a medium dose, and the high mode applies a high dose. Your choice of mode will affect the kV and milliampere to compensate for brightness, as we discussed yesterday. Additionally, you must ensure that the parameters are suitable for the specific patient's needs and conditions. Choosing the appropriate mode for the examination is part of selecting the parameters that provide you with a suitable examination, just like deciding whether to use a high kV or a low kV. This is crucial for achieving optimal results. Therefore, when dealing with sensitive cases, such as children, extra care is needed. For example, if I have a child, what should I do? This is considered part of dose optimization. For example, this grade will increase the dose on the patient as much as possible. However, I should not use the magnification technique because the magnification technique will increase the dose. All of these factors are considered during the examination. As for dose limits, as I mentioned, I have public and worker dose limits that must not be exceeded. My shielding calculations and personal dosimeter, which gives me readings every month or every 3 months, must have a certain limit that should not be exceeded. However, the patient does not have a dose limit. The patient themselves does not have a dose limit. There is no such thing as saying that this patient should not exceed a certain dose or value. Why? Because the issue is justified by the benefits and risks. Until today, there is no dose limit for patients, but they have started to establish something called dose reference levels. What is the dose reference level? It means that I now have a specific procedure, for example, a CT abdomen pelvis. If I perform this CT abdomen pelvis in my hospital, I have 100 cases or 1,000 cases. I should start to conduct a statistical analysis of the dose. These cases are related to the dose lens product or CTDI volume, which are dose parameters that give me an indication of the dose for this patient based on the number of cases I have, whether it's 1,000 cases or so. Now, I start to say that in the case of CT, there is something called the 75 percentile, which is 75% of the mode of my data. This means that I calculate something called the mode of my data, similar to the mean or average, as part of statistical analysis. And I take 75% of that mode value, which is my reference dose level. This is the investigation level. This is the value I have. I need to conduct an investigation. I need to ask why this patient's dose has increased by 75%, and why that patient's dose has decreased by 75%. So, how will this help me? This should be done every 3 years in any hospital I work with. What is its function? Its function is to monitor your optimization techniques. For example, I calculated the doses for a patient and found that in the CT, computed tomography, and X-ray, the dose is very high. I brought in my medical physicist and the doctor saying, hey, guys, this dose is very high. Let's make adjustments to the protocols. I asked the doctor, is the image quality acceptable? He said, yes, it's fine. So we will set these parameters to achieve that image quality. This is called optimization. After 3 years, I conduct another survey to see where I stand in relation to my dose reference level. If I have exceeded it, I will need to establish a new dose reference level from a new high survey, and I will need to repeat the optimization process and the reduction process. This was a monitoring process for me. I conducted optimization and techniques, and new machines appeared and all of this. I conduct the survey again and see where I stand. I said I would set my DRL to the new DRL and so on every 3 years. This is the dose reference level that we are starting to hear about today, and it needs to be established at the level of organizations, at the level of hospitals. It can be implemented at the hospital level or the radiology center level. It doesn't necessarily have to be at the national level. However, it is preferable to implement it at the national level because, for example, I can conduct a survey of 20 hospitals, 10 hospitals, and work on specific procedures for a specific examination. And I should have a national DRL, not a local DRL. The national DRL should be for the country itself. Many countries are already doing this, and they have DRLs for all examinations or procedures. One of the most challenging aspects of establishing DRLs is that the situation varies depending on the case and condition. So far, the standard for me regarding CT, computed tomography, examinations and X-ray examinations, as well as other procedures like mammography, is that they do not have significant variation in exposure time, so there won't be much variation in the dose quantities or the absorbed dose that the skin will receive. But fluoroscopy is one of those things that has a high dose, so this situation is a bit difficult. Right. For example, to say what its dose is in 100 cases. It's difficult. It's hard to apply the same approach to all these cases because, as you know, it depends on the case and the procedure. One installation might differ from another, so you'll find some variations in the end. Okay, so we talked about that. All right, doctors, are there any problems? Okay, what about the application for the dose reference level? I have two types of radiation: ionizing radiation, like X-ray or gamma rays, being high energy, and non-ionizing radiation, like MRI, radio waves, being low energy. High frequency causes ionization, low does not. Imaging types, like air imaging. Ionization differs, as we mentioned, in energy. This is my electromagnetic spectrum. Now, for ionization, you need 34 electron volts. This 34 electron volts is the energy that can cause ionization. These are the sources that contain ionizing radiation, which falls within the range of physical modification for ultraviolet radiation, including ionizing radiation, X-ray and gamma rays with high frequency and high energy. The idea is that the energy of radiation can cause a knockout effect and eject electrons from their orbits. This is the concept of ionization. The idea is that ionizing radiation, there are ions, or what I call free radicals. The idea in ionizing radiation is that I have X-ray, gamma rays, beta particles, alpha particles, and neutrons, which are types of radiation that have an effect or impact and can cause ionization. For example, I want to know the mechanism or what exactly happens. The idea or concept of what is happening is that I have So, do we perhaps already know about alpha, beta, and gamma radiation? Or do we need to go over them again? We know the topic really well, really well. Okay, if I have a group of cells, and this group has been exposed to alpha particles, or to X-rays and gamma rays, the alpha particles are considered high-density particles, with something called high linear energy transfer. Linear energy transfer means the amount of energy lost over a very large distance, for example, in 1 centimeter, which is very significant compared to X-rays and gamma rays. That's why X-rays and gamma rays are considered to have high penetration power, while alpha particles, being high-density particles, cause a large amount of ionization that is localized, meaning in the specific area they are in. In contrast, X-rays and gamma rays have low linear energy transfer and low ionization density, while alpha particles have high density ionization and high linear energy transfer. So the interaction of alpha particles here is significant due to their high density ionization and high linear energy transfer. When alpha particles enter, they begin to cause significant ionization. The amount of ionization occurring from alpha particles is much higher than that from other types. For example, if we look at the energy deposited per unit of track or per unit of distance, we find that for gamma rays, the energy loss might be around 0.2 kilo electron volts per micrometer, while for protons, it is about 4.7, and neutrons have a different range depending on their type. For instance, alpha particles can have energy levels around 166 kilo electron volts. On the other hand, space radiation, which comes from cosmic sources, is very high, around 1000 kilo electron volts per micrometer. When comparing alpha particles to X-rays or gamma rays, for example, if we compare it to 250 kilovolts X-ray, the difference is significant. Now, what I want to say is that when radiation enters our bodies, it causes something called ionization. The image you are seeing is what is considered the very crucial component or essential part inside the cell, which is DNA. Every day, DNA undergoes extremely substantial damage at 10,000 to 1,000,000 locations. There is very daily damage occurring within the DNA of the cell, but the highly specialized repair enzymes come into play to efficiently and effectively fix the damage and allow the cell to continue to function properly again. Now, if this repair process is not efficient enough, if something goes well or fails, you might possibly have a mutation in DNA. This mutation can potentially cause effects such as cancer, leading to the proliferation of cells in a certain way, which may then become cancerous cells. Alternatively, it can potentially lead to a specific genetic disease that may develop in some cases. All right? Generally, the topic of this river occurs and happens significantly, and notably, unless an external or outside factor increases this merging. I have this merging that occurs in the amino acids that are present here between the two strands of DNA, which is the helix structure. Here I have one strand connected to another with amino acids. Damage can occur, or 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 a double can happen, meaning it can happen here and there. In the double-strand break, this means that there is a merging in the DNA. In the double-strand break, this can cause cancer. The merging in the DNA can kill the cell. Okay, what is this topic based on? Is it based on, as we said, a certain factor that increases what is happening or not? The most likely scenario is the security base that connects them together. Then there's the next probability, and this double is the last probability, which is less likely. Its probability is lower. As we mentioned, it depends on an external factor. The external factor we are talking about is radiation. So what does radiation do? You have two effects if this radiation. It talks about particles, meaning we are discussing alpha particles or beta particles, which cause ionization by themselves. This is called direct ionization, meaning they interact directly with the atoms present and cause ionization. Okay, that's clear. Now, what about the indirect effect? The indirect effect is when there is water in our bodies that interacts with radiation, especially with X-rays and gamma rays. It starts to create something called a free radical. The water molecule breaks down into ions, and these ions are the ones that cause the hitting and the merging that occurs. That's why I call it the indirect effect of radiation. So, according to whether it's X-ray, gamma ray, alpha particle, or beta particle, if you're talking about vertical, then you're discussing the direct effect. If you talk about X-rays or aesthetic X-rays, you are discussing X-rays. If DNA has been damaged and this damage can be repaired, then there is no hazard and no problem. However, if this repair fails, it triggers programmed cell death, known as apoptosis, and the cell itself undergoes degeneration and dies, in particular, such as when this repair fails. This is like, you see, for example, as an illustration, it always happens with the river. If we increase the exposure in this scenario, this is always at my level of 100 milligray. Above 100 milligray, the three shields are 100 milligray. The effect dependent on the dose begins to occur. If you are exposed to a certain dose, you will experience a certain effect. Excuse me, but could someone please mute their microphone? As a result, if the dose is very high, it is very likely that your repair mechanism will fail, leading to cell death or cell degeneration. What happens next are acute effects or fetal effects. These are the ideas related to the body and the physical concepts. Due to the failure of repair, this falls under the deterministic effect. Incomplete repair means that repair occurs but is not complete, which in this case causes mutations and can lead to hereditary effects and cancer. This is categorized under the stochastic effect or probabilistic effect, which is the probabilistic impact. As we say, one photon can cause cancer. It can happen with just one photon. One photon can cause cancer. What does that mean? It means I am not relying on a large dose. I am not depending on the amount of radiation to increase the effect. I could be exposed to radiation and it could cause cancer. There is a high probability of that. So, what increases this probability? The probability of the stochastic effect increases with an increase in dose. You should note that it increases with the dose. When I talk about the stochastic effect, I will say that the stochastic effect increases with an increase in dose. Okay? The stochastic effect is considered independent or does not depend on the dose threshold. What is the threshold? It occurs at low doses, which is why this is the part we are all exposed to. We are talking about low doses in radiology or nuclear medicine. These are all low doses. I have 3 shields above 100 milligray, which is considered as per guidelines. This is my 3 shields below it. You are now in the stochastic effect or the probabilistic effect. The deterministic effect, as you saw in the images of the skin burn that occurred, is a result of exposure to 2 gray or 3 gray. This dose is what caused the skin effect, or the skin burn that happened, or the erythema that occurred. What is this a result of? It is a result of the deterministic effect. That is why it is very important for you to repeated phrases. Most of the things that have been presented, like the exposure to the patient, are considered fluoroscopy work. But in CT and other X-rays, there are very low doses of exposure, whether it is to the patient or the staff or the workers present, even if there is scattered radiation. However, the presence of the stochastic effect or the probabilistic effect remains the main factor that led us to have radiation protection, which includes time, distance, and shielding. We should not underestimate the dose because, as we said, one photon can cause cancer. Molten costume. If there is an exposure of 1 milligray, 2.5 base damages occur within the DNA. With one base damage happening in one resistance and a base damage occurrence of 0.04 resistance. The station means or 0.4 or 0.04 locations, meaning every 100 cells have been exposed to 1 milligray of radiation. The double strand break occurs in 4 of those cells, which is why I say it is considered the least occurrence or the least damage in DNA. What damage occurs? All right. Let's see that this issue happens over a long time. The interaction that occurs between radiation and our body involves free radicals that break down DNA. This process takes time. You can imagine it happens over a period, but it actually occurs in a fraction of a second. After 1,000th of a second, the breaks start to happen and basic damage begins. After 1 second of exposure, the repair process starts. If this repair fails, cell death or mutations can occur within an hour to a day. So, to recap, in less than a second, you are talking about the breaks that happened and the basic damage that occurred due to the interaction with free radicals that broke down the DNA. All of this happens in less than a second, and the repair starts after 1 second. Once the repair begins, if it fails, then mutations or cell death can occur within an hour to a day. The period I am talking about is the limit of the occurrence of clinical symptoms, or this symptom in medicine. For example, if this effect occurs, it could be an acute effect, which I call the early effect, such as deterministic effects leading to cell degeneration or cataract. This period for me is the incubation period, and the effect, especially with stochastic effects, can take years to manifest, leading to cancer or hereditary effects, especially when discussing the mutations that occur. So, to go back to what we were discussing, you are talking about failing to repair properly and that the dose increases with a specific threshold that should not occur before, but happens after this threshold. The stochastic threshold is that 1 photon can cause cancer, and there is no probability threshold that increases with the dose. Complete repair leads to mutations and is responsible for genetic effects, hereditary effects, and cancer. Meanwhile, the deterministic effect is responsible for cataracts or the vital effects present. In the deterministic effect, as I previously mentioned, damage can occur, and this damage can affect normal, healthy cells. If these cells are exposed to ionizing radiation, they may potentially become damaged cells. If there is successful repair in these affected cells, the effect may not be immediately noticeable, or it may lead to a temporary dysfunction, meaning that the cells may take some time to fully recover. This will be thoroughly discussed under a certain threshold level. Above that specific threshold, the damage becomes irreversible and permanent, leading to a complete loss of function or morphological defects that are visibly present. This is essentially the meaning of deterministic effects. As we were previously discussing, the sensitivity of our target cells to radiation, exposure increases significantly with higher replication rates. Cells with particularly high replication rates will be more severely affected. Unlike, for example, the testes and these individuals, when you compare this to the nervous system, you find that the extremities of our bodies have a low dividing rate, which is why they are less sensitive. That's why, even when they set a dose limit for the hand, they said 500 millisieverts, while for the eye, they said 20 millisieverts. He elaborated further by stating that exposure to large parts of radiation is generally not considered to be a significant problem or issue in most cases, and therefore it is important to refer back to the topic of cells and the activity of those cells in detail.